All right, topic Tuesday. Nobody cares about the hair. Telling you, nobody's that interested in what I do every minute of my life. All right, topic Tuesday. Not too sure which one of our medical contributors contributed to this post, but we'll find out towards the end. But hoping that your week was off to a great start. And on this particular day, we were going to talk about the Bentel procedure. There's a Ross procedure, a Bentel procedure. There's so many different procedures for what those of us with aortic disease might have when it comes to a surgical intervention. And the Bentel procedure is actually a surgery that is used to treat any type of aortic root abnormality that involves the ascending aorta and the aortic valve. So remember, your aortic valve, not part of the aorta. Let's get that distinction. Aortic valve is part of the heart. So is the mitral valve, the tricuspid valve, the pulmonary valve. They're all valves to the heart. This one just happens to exit into the beginning of the aorta. So sometimes we get that confused and we incorporate, just generally speaking, an aortic valve as part of aortic disease, but it is not, unless it's under certain circumstances. And we'll talk about that another time. But this technique, the Bentel technique, was actually created to treat patients with aortic root aneurysms and then modified in several aspects to treat other issues of the aorta. So the Bentel procedure generally involves the insertion of a mechanical valve to replace the aortic valve. Okay, and this would require you to be on lifelong anticoagulation like Coumadin, like warfarin, not like Plavix, different type of drug, not Eliquis, different type of drug. Typically, it's going to be warfarin and I believe Coumadin. But the Bentel procedure also fixes the aortic root. So this is the type of surgical procedure, again, that would implant a mechanical valve to replace the aortic valve that might have aortic regurgitation, might have bicuspid, but it is going to require lifelong anticoagulation because it is mechanical. But the main benefit of the Bentel procedure is that it can take care of an aneurysm and malfunctioning valve all at once. And as I'm reading this to you, I'm thinking about myself, and that's probably going to be the procedure I will be having at some point in time. So I'm learning. This is great. This surgery actually provides a long-term solution. So below, which I'm going to show you, is a representative picture of what the Bentel procedure looks like. So if you take a look here, you have your heart and you have, this is the aorta right here, okay? This is where your aortic valve would be. This is leading into the coronary artery, but this is the part of the aorta that's getting replaced. This is it. This is it right here. This is the artificial mechanical valve. You would think it would look like a valve that has 3 cusps or leaflets, and it doesn't. Actually, Dr. Ben Udelman, when we had him on our show last week in a live, showed us what the mechanical valve looked like, and it kind of just looks like it's got vents that flap in and out like you would find in your home, which you can open and close to let your heat or your AC in. That's what it looks like. It almost looks like it's just 2 flaps. So very interesting how it goes from 3 to 2. But this is the area in which it is, and it just is an all-in-one, basically. It kind of looks like a graft, right, with a valve, but it's all one piece. So the Bentel procedure may be needed for patients that have aortic regurgitation, which I had mentioned, and that's when the valve doesn't close properly and causes a backflow or regurgitation of blood each time the heart pumps. Aortic stenosis, which is when your aortic valve becomes stiff and doesn't open properly. You could also need this procedure if you have Marfan syndrome, which is a disease from birth that weakens the thickness of the aorta's wall. Doesn't mean it shows up at birth, can show up at any time after birth. Or you could have an aortic aneurysm, which is just the widening of the aorta, causes you to need to have your valve repaired or replaced. Or if you have an aortic dissection, which is when, again, the inner layer of the aorta splits apart from the other layers. As with any surgery, there are going to be risks associated with the Bentel procedure, and the common risks would include bleeding, ending up with some type of arrhythmia or abnormal heart rhythm, short-term memory problems, and I'm going to assume that that's just from being on a bypass machine, just like any of us who have had a dissection. I think we can all agree that we have had a degree of short-term memory, but it can also cause blurred vision, some difficulty concentrating, possible risk of infection, heart attack, stroke, blood clotting, and even death. This is just the reality. I'm sure that if you're having, uh, uh, I don't know, tonsils taken out, knee surgery, there's still risks of some of these things happening as well. You could be at risk for blood clots, stroke, heart attack, death as well. So a lot of these risks they just have to be explained to us. Okay. Doesn't mean that there's a high propensity for these things to happen. But if you're at risk of having an aortic root abnormality with the aortic valve or ascending aorta, you do want to talk to your doctor about this, because dental procedure might be the type of procedure that you have. And now I have found out that this is all we have for today's session, which was last Tuesday. And this was written from Duke, who is, last thing I checked, interviewing for his residency. I'll have to find out if he has actually landed someplace. But that was your topic Tuesday.